The Nigerian Medical Association is pointing a spotlight on the operations of private medical facilities in Gombe State. The association, at its general meeting, identified the crucial role of private hospitals in healthcare development, but emphasized the need for strict enforcement of standards and regulations. Correspondent Landry Adeyemi has more.
More than any other single event, the COVID-19 pandemic exposed the frailties of Nigeria's healthcare system. The challenges have been compounded by the mass departure of health workers seeking greener pastures. The Gombe State branch of the Nigerian Medical Association, in its annual general meeting, is looking at how private medical facilities can better support the healthcare system. Experts looked at different angles to solve the problem. The consensus is that universal health insurance and improved funding are the starting point.
It is all important, but they also have their some challenges, especially the issue of funding, the issue of payment of for the healthcare and everything. So it's a very huge tax.
Catastrophic expenditure is what deals with many families. I know of a person in Padang, just some few miles from Bay, who sold his house to undertake the medical treatment of his son.
Private hospitals and other medical facilities have been rapidly springing up. Some would say to fill a gap, others would argue that these profit oriented healthcare providers are only out to exploit opportunities. The solution preferred is stricter enforcement of regulations.
The ethics, the practice, the availability of basic things in the facility. You don't register a facility and then you don't put in basic things in the ward, in the theater, in the laboratory, and even the number of health personnel that will run that facility. So we must make sure that all these things are available. We have a dearth of medical practitioners. And this cuts across the entire country, but it's even worse in this part of the country. And private practice is very necessary to complement the government service.
This is one of the many private medical centers in Gombe State. It's much bigger and better equipped than primary health care centers, but smaller than general hospitals and referral centers. It is true that some private health facilities may breach regulations and even engage in malpractices, but it's crucial to note that many of them are actually filling the gap and rendering life-saving services where the government has failed. Landry Hadiemi, TVC News, Gombe.
Still on health matters, the federal government has promised to support initiatives and programs geared towards the elimination of neglected tropical diseases in the country. The Director and National Coordinator of Neglected Tropical Diseases at the Federal Ministry of Health, Fatai Oyediro, gave the assurance at the opening ceremony of a 2-week capacity building training on backfly entomology held at the Osun State University, Osogbo. TVC News correspondent Rafi Hamid reports.
Black fly is one of the major causes of neglected tropical diseases. These include river blindness, body irritation, fever, black skin diseases, vision loss, and other critical ailments. According to findings, 40% of 1.7 billion people affected globally by the diseases are in Nigeria. This capacity building training is part of efforts to ensure reduction in the spread. Participants are drawn from selected universities, some other higher institutions from the 6 geopolitical zones of Nigeria and the Federal Ministry of Health.
I wish to assure you of Federal Ministry of Health's continuous support and partnership in any or all aspects of NTD's programming.
Emphasis will be on advocacy against the diseases and ways to improve study of black fly entomology, its transmission, and how to ensure total elimination.
Currently, Nigeria is winning the war towards eliminating onchocerciasis as a public health problem in the country. Our studies have revealed that Nigeria can win this war by also complementing the annual distribution of ivermectin with vector control strategies.
29 million Nigerians no longer need onchocerciasis after several efforts, and this training aims to achieve more success.
In Nigeria, we already have uninterrupted transmission in Plateau State, Nasarawa, Zamfara, Kebbi, Kaduna, Delta, Imo, Abia, Enugu, and Anambra. And more than 59 million Nigerians are no longer taking the drug because the disease has been eliminated or interrupted. But there are other areas where the disease is still very endemic. We are still treating them and evaluating them.
The training was declared open by the Vice Chancellor of the university, Professor Clement Adeboye.
It is therefore my hope that all participants will be actively involved in the training and benefit immensely from the pool of entomological intellect gathered here as resource persons.
It is hoped that the participants will have been more equipped after the 2-week training so that they can train others in their various institutions. Rafiu Hamid, TVC News, Osogbo.